So today the topic of my discussion will be about the most frequently asked questions in the various NEET PG entrance exams is about the blood cholesterol lowering agents and the drugs what are used in the treatment of hypercholesterolemia or hypertriglyceridemia. So this comes as a very important questions in all the NEET PG entrance exams. So students, beginning with the blood cholesterol lowering agents, the drugs what are used for them, it basically comprises of the 5 very important drugs. The first are categorized as the statins, the next the fibrates, the third classes of drug, it is the selective cholesterol absorption inhibitors, and the fourth, the drug which can be used as a blood cholesterol lowering agent, it is the vitamin B3 or the niacin, and finally another important drug, that is the bile acid binders. They are also used in the treatment of hypertriglyceridemia or hypercholesterolemia. So these are the 5 important classes of the drugs which are widely used as a blood cholesterol lowering agents. So beginning with the first very important class of the drugs, that is the statins. So statins are the drugs which are used very widely in the treatment of hypercholesterolemia. So students, the patients who are suffering from hypercholesterolemia, there the most important, the foremost drug what is used, it is the statins, and the mechanism of the statin drugs can be better understood if we look at the enzyme HMG-CoA reductase, that is the hydroxymethylglutaryl coenzyme A reductase. So this is the key enzyme which is responsible for the synthesis of cholesterol in the liver. So the statins drug, they are going to elicit their mechanism of action by just binding and inhibiting this enzyme HMG-CoA reductase. So the statin drugs, what they are going to do is they are going to inhibit this HMG-CoA reductase enzyme, which is the principal or the key enzyme in the synthesis of cholesterol in the liver. So ultimately this enzyme is inhibited and there is a decrease in the level of the cholesterol synthesis. So ultimately, this is the mechanism of action of the statin drugs, and the examples of the statin drugs include the simvastatin, the atorvastatin, the florvastatin. So these are the statin drugs which are widely used as blood cholesterol lowering agents. So from the MCQ point of view, if we talk, the safest statin what is there, it is known as by the name of the pravastatin. Moving on to the longest acting statin. So the longest acting statin what is there as used as a blood cholesterol lowering agent, it is the rosuvastatin. So student, these are the 2 very important frequently asked questions in the NEET PG entrance exams. So do remember, the safest statin is the pravastatin and the longest acting statin is the rosuvastatin. Moving on to the second important class of the drugs which are used as blood cholesterol lowering agents are the fibrates. So the fibrates, the examples of this class includes the fenofibrates, the clofibrates and the gemfibrozil. So these are the examples of the fibrate series, and the mechanism of action of these fibrates are it acts by decreasing the levels of low density lipoproteins, and the fibrate drugs, they hasten the elimination of the triglycerides from the body. So the mechanism of removal of the triglycerides from the body, the fibrate drugs are going to hasten the process for the elimination of the triglyceride drugs, so triglycerides from the body. So students, moving on, what they do is the fibrates, they are used in the treatment of patients who have high triglyceride levels in their blood. So it is in the patients of hypertriglyceridemia, the drug of choice is the fenofibrate. And the distinguishing feature for the statin sets, the drug of choice in the patients for hypercholesterolemia, they are treated by statins, whereas the patients who are suffering from hypertriglyceridemia, they will be treated by fibrates. Students, these forms are another very important MCQs in the exam, the multiple choice questions, the frequently asked questions. Drug of choice in hypercholesterolemia, it is the statins, whereas the drug of choice in hypertriglyceridemia, it is the fibrates. Moving on to the next third class of the important compounds, the drugs what are used as blood cholesterol lowering agent, it is the selective cholesterol absorption inhibitors. So the selective cholesterol absorption inhibitors, the very and the only example for this drug, it is the ezetimibe. So ezetimibe, it is the only drug which is used as the cholesterol absorption inhibitors. So the mechanism of action of this ezetimibe, it blocks the cholesterol from being absorbed by the intestine. So students, the cholesterol absorption inhibitors, they are going to inhibit the absorption of cholesterol from the intestine. So they help in the decreasing the blood cholesterol levels. So example, the very famous and the very most important example of this class of the drug, it is the ezetimibe, which is very frequently asked in the various competitive exams. Moving on to the fourth class of the drug which can be used, it is the niacin or the vitamin B3. It has been found, students, that vitamin B3 or the niacin can be used for lowering the blood cholesterol levels. So how the niacin is going to elicit its action? The niacin, it slows down the production of the low density lipoproteins and the very low density lipoproteins. So niacin elicits its action by decreasing or slowing down the production of the harmful LDLs and the VLDLs. So, all right, and thereby elevating the high density lipoproteins which are very important, which are beneficial for the body. So they ultimately, it leads to an elevation of the high density lipoproteins, and they slow down the production of the low density lipoproteins and the very low density lipoproteins. And the niacin also elicits its mechanism of action can be seen. It acts by inhibiting the lipolysis in the adipose stores. So whatever are the adipose stores in the body, so the niacin, what it is going to do is, it is going to inhibit the lipolysis in the adipose cells. So it also acts as a blood cholesterol lowering agent. Moving on to the fifth important class for the blood cholesterol lowering agents, it is the bile acid binders. Under the bile acid binders, the two very commonly used drugs are the cholestyramine and the cholestyramine. So cholestyramine and the cholestyramine, they are very important, very commonly and very famous, the blood cholesterol lowering agents, and their mechanism of action can be understood that by looking at the fact that the bile acids what are produced, these bile acids, they are actually responsible for the absorption of dietary fats. So from whatever the dietary fats what we are consuming, the bile acids, they are the chief uh, chemicals which are going to absorb the fats. They are responsible for the absorption of fats from the intestine. So the bile acid binders, the drugs, the bile acid binders, they are going to inhibit the dietary absorption of fats. They are going to inhibit the dietary absorption of fats by the bile acids. So the bile acids won't be able to absorb. These bile acid binders, they are going to bind to the bile acids, and thereby they inhibit the absorption of the fats from the intestine. So ultimately they help in the blood cholesterol lowering agents. So students, this was the short review of the different types of drugs which are used as the blood cholesterol lowering agents. Students, if you do like my video, don't forget to subscribe my channel and do press the bell icon so that you can be further updated about my newer videos. Thank you for watching.